This podcast is recorded on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people.
British Columbia, I've seen your mountains high, seen your pretty rainbows and your blue crystal skies, watched your winding rivers as they flow around the bend. To me you're not a stranger, you'll always be a friend.
Coming to you from the West Coast, this is Politicos. Today is April 23rd, 2020, and this is episode 186.
I'm Stuart Loneboom.
And I'm Ian Bushfield. On today's show, we have a special interview on air pollution and COVID-19 with the University of British Columbia's Dr. Michael Brower, something you recorded without me last Friday, and that patrons will have had a chance to listen to. But before we get into that, we'll be able to talk about transit funding and sick days, which have been the points of discussion in the last few days. First, though, we have to thank those who continue to help make the show possible. We're up to 95 contributors every month, thanks to our newest patrons, Warren and Jason. We're now at $292 a month US. It's so close to that $300 mark that I really just want to see us get over. Thanks to everyone who's sticking around. One of the bonuses we're looking at, and I don't have a specific threshold in mind yet, but we've just put up the transcript of our conversation with Dr. Brower at the website politicos.ca. If this is something that you think is helpful or good for us to do for accessibility, maybe chip in a bit more money per month so that we're able to cover our editing costs, cover the cost of the automated transcription service, which is actually only about $10 a month, but also cover the cost of cleaning that up and getting it online. So go to patreon.com/politicos and help us out. And of course, for the duration of the crisis, we've made our patron Slack open to all listeners and supporters. Visit legandbootmedia.ca and fill out the form there. Apologies if it takes a couple days. We don't check it every day for new listeners, but I did see a couple more people who I just added this afternoon. And as always, Politicos is in partnership with BC Today, British Columbia's daily newsletter dedicated exclusively to BC politics. Sign up for a free trial to have unique coverage of the BC legislature delivered to your inbox every morning. Listeners to Politicos enter the offer code CITIZEN for access to a special rate. For your free 2-week trial of the newsletter, go to politicstoday.news/free-trial. Let's jump into our roundup of the latest news. Let's start off with transit funding. You've been looking at some big slides coming out of the Translink Mayor's Council, I believe it is, looking at how bad things are. How bad are things, Scott?
They are not great for transit in the Lower Mainland. So today was the monthly Mayor's Council meeting, and a big part of that was the funding situation with Translink. We've been hearing stories for a couple weeks now about revenue shortfalls, and earlier this week, I think it was, they announced they were going to be cutting a bunch of routes, but we have some numbers. And right now, they're losing about $75 million a month compared to what they budgeted for. So rather than the $140 million Translink was expecting to take in April, they're projecting to only get about $65 million. And that's from losing funding from across a bunch of different sources. Fares being the big one, but also things like fuel taxes have gone down quite a bit.
Yeah, really the only money it looks like they're still pulling in is the property taxes, which makes sense because that's a very fixed amount. People's property hasn't suddenly up and vanished, but every other levy and revenue source they have is kind of dried up, which really highlights how, I guess, it's hard to say it's a fragile system because of how big of a shock COVID-19 and this change has been, but it's not a good situation because Translink doesn't have the ability to run a massive deficit or take out a giant loan in the same way the government can. So this is a place where government's going to need to come in if they want to keep this agency running at the, if not world class, at least continent class, continent leading quality it's been. There's a big hole in this budget. We're talking, $500 million a year or more, almost 2/3 of a billion. Lots and lots of money needs to come from somewhere.
Yeah, and that's been the challenge. So right now they're kind of covering some of the costs by doing service cutbacks, as already mentioned, and drawing down reserves, but that's only going to last so long. And in the meantime, senior levels of government haven't really stepped in at all. And on Monday, the premier was asked about this, and he basically passed the buck to the Fed, saying, "Oh, we're looking into it, we're talking to them," but that doesn't really address the core need right now. And as we've talked about a bunch of times with pretty much everything the government's rolling out, this really does seem to be one of those cases where speed trumps perfection, and figuring out exactly who gets to pay for it between the feds and the province just doesn't seem to matter nearly as much as getting the money out the door to Translink so they don't have to cut more services.
Yeah, I mean, I fully agree with that. To get a sense of the scale we're talking about, they've shown that their ridership has dropped from, a baseline, if it's 100 on March 1st or in February, by March 23rd, it was down to 23%. Just, 1 in 4 trips were being taken. By April 6th, they were down to 17%, where they'd done a 20% service reduction, and they're kind of still sitting around there. And, when they're serving 1 in 8 as many people as they usually would, it's not surprising that they're going to be cutting a bunch more services and taking more buses off the roads. But, if you've ever been to a city that doesn't have as good of a transit system as Vancouver, fewer buses makes you want to ride it less. And so kind of a vicious cycle. So the money's got to start flowing, and it's going to take all levels stepping in. And hopefully we see that sooner than later.
Yeah, because transit really is an essential service. And based on the surveys that TransLink has done, a huge amount of their current ridership is people who need to use transit to access essential services, whether or not it's as workers or people taking advantage of those services. And it's just hard to do physical distancing when you're cutting back routes and cutting back on the number of buses you run. This is the unfortunate situation where you just have to run a lot of buses at low capacity just to keep everyone spread out. And so far, the service cuts have been some of the least used routes in the system where there's redundancy and they can change that around a bit. But the next round of service cuts might not have that. We're talking Translink because the numbers came out today. So far, I haven't seen reports from BC Transit, which covers the rest of the province, but they're probably in a similar situation. And the only other thing I just want to do is emphasize just that the province really needs to get its ass in gear on this one. And this is not the time to be playing who gets to pay with the federal government like provinces like to do in normal times. So that's the acute problems right now. But part of the long-term challenge is what happens after. And Translink's drawing down some of their revenue right now. They're not having to take on some of the debt they were expecting to, just some of the capital spending's being put on hold temporarily. But this is going to be a long-term challenge, and they've outlined 4 different scenarios for what the after effects are going to be. It's going to have quite a range in what their shortfalls are going to be. But the province also needs to be seriously thinking about what happens next and what that means for capital works that are needed, because this could impact, if it keeps going on and they remain with this funding gap, have to cut back on some really needed expansions that aren't just needed to get people around, but also going to be helpful for stuff like air quality, which you can hear all about in the interview later in the show.
Good points. Well, one of the other political footballs that it feels like everyone's kind of dodging or just hoping that the EI programs will step in on is this question around paid leave and sick leave. BC, as we've talked about before, didn't even have required or guaranteed sick leave of any sort until this crisis broke out. And one of the only bills that has been passed by the BC legislature this session, really, in that emergency sitting, was the agreement with the BC Liberals and BC Greens to allow for 3 unpaid sick days a year and unlimited COVID-19 unpaid leave. Well, now there's been a number of outbreaks at major industrial sites, notably 2 poultry processing plants here in BC and a bunch of meat plants in Alberta, and I'll go into some of those specifics, many of which seem to follow cases where people came to work sick. And the guidance has been clear. If you're sick, stay home. Employers shouldn't be requiring you to come in. But for many people, not getting a paycheck for a significant amount of time really impacts their ability to stay home. So I can understand the incentive for people to go in when they're sick, or even, maybe it's just allergies kind of sick.
Just to be clear, that the provincial health officer has said, even if you think it's allergies, just stay home.
And now we have here in BC at the United Poultry Plant 29 cases. Today announced the sister plant in Coquitlam, Superior Poultry, has 2 cases. Even more shocking is in Alberta, where Cargill Meats, the largest meat processing plant in Canada, or at least one of the largest, they have 480 workers now affected, 1 death in that plant, and in the surrounding community, there's another 140 cases that could be tied to the outbreak in that plant. That plant's been shut down. There were reports of workers really trying to raise alarms about how things were going at this plant before the full outbreak had become well known. And one of the most shocking things that I think came out was that the plant early in March, when it underwent its inspection from Alberta Agriculture about are they meeting the health and safety codes for COVID-19, did this inspection by a video inspection. Alberta Agriculture tries to defend it as an employee was directed to walk around with the video camera in the plant and look at the things they were told to look at, and that helps prevent the inspector from being potentially exposed, but it feels like they missed some key things in this plant. And then there's at least another couple meat plants in Alberta, most notably JBS meat plant in Brooks that has 124 cases and another death in that community. And so there's a lot of questions in BC and in Alberta about workplace safety, about making sure people stay home when they're sick, and how to ensure this.
Yeah, you think with anything covering the food industry that there would already be processes in place that people don't work sick around food.
Those would be the places we want to be the most clean in the country, but I think we'd all be a little bit disappointed. I don't think they're, rotting, disgusting places, but I don't think they meet the standards we'd hope they would otherwise. All of this has led John Horgan to kind of muse about this idea of paid sick leave again, and he's announced that there's going to be some more dialogue and discussion around the question here in BC. No commitments to anything specific. He told the Vancouver Sun following a cabinet meeting this week, it's important we put in place a framework so through WorkSafe BC we can have safe workplaces and an understanding that sick pay is there not just to get extra dollars to people who are ill, but perhaps ensure those workers don't come to work because they know they're not going to forego their wages of the day. And so I think he's still hoping for industry buy-in on it, and there are definitely workplaces that are much better at this than others. But when you have gaps, that's where the law seems to be necessary. And it's been frustrating to not see him move faster on this, and I'm not sure the reasoning behind that.
I think it goes to more than just the law. In general, I think we haven't had a great culture around taking time off from work when sick. I mean, I've definitely before this had gone into work with colds, maybe even a flu one time, and not because I couldn't have taken a sick day. My work actually gives me a fair bit of flexibility on that, but just because I'd have more work to do at the end of it. It would just pile up, and I'd have to work even harder afterward. And that's I think kind of part of the problem is that even people who have a lot of the flexibility that not everyone's lucky enough to have, there's just kind of an expectation that you suffer through it and grit your teeth and push on if you're not really sick. And if there's one thing the situation's shown is that wasn't necessarily a great way to do about it, and we were on borrowed time there.
Yeah, absolutely. And it goes back even before work. I remember in elementary school, we had awards for perfect attendance records, and expecting elementary age kids to be there every day is really weird when you start to think about it. Like, kids are sick all of the time. They have doctors and dentists and all these other things they need to go to. Like, yeah, you shouldn't be skipping a lot of school, but missing a class or missing a day here or there isn't a bad thing. And trying to reward not missing creates a weird incentive, and it's a sort of Protestant work ethic that kind of pervades everything that I think we really do need to rethink. I think the law is a very helpful way to push societal change and also flow with it. But yeah, people need to rethink the approach to work.
Yeah, you do need some sort of backstop here, and there are challenges with how you structure it because a lot of the places that have workers who are the most exposed and most vulnerable and interact with the public the most are also small businesses that don't really have a large reservoir of capital or money they can set aside to pay people when they don't show up to work for several days because they're feeling sick. So, how this gets structured is going to be a tough thing to do going forward. And there's a sick leave part of the EI program, but that only kicks in after a week. And it's really kind of structured around long term illness rather than, oh, you have to miss 4 days of work in a row because you have the flu.
And trust me, trying to get money back from EI right now for anything other than COVID leave is going to be a joke. I took 2 weeks off for caregiver leave recently, and I've applied for that, and I expect to see that money maybe in June if I'm lucky. Things are just going to be slow for a while. And yeah, EI is not a great system. There's also a political angle of it as well, where the BC Liberals would traditionally have been much more skeptical of a broad mandatory sick leave policy, paid sick leave policy. And right now, the BC NDP really needs unanimous consent to get any new legislation through the legislature. If they don't, the Liberals can just throw all their members in the House and shut down a bill. So making sure all three parties are on the same page means that no one pulls any tricks. I don't know what the BC Liberals' position on this is. I don't know what the BC Greens' position is. I don't even know what the BC NDP's position on this is, but I hope they can all find some way to move forward constructively to make sure we're protecting workers, protecting our community, and doing what's being asked of us without causing additional unnecessary hardship.
I also haven't heard from the BC Liberals on what their view on sick leave is with respect to the current situation, but I would imagine they would voice the same concerns I just did about the impact on small businesses, particularly small businesses that are really struggling at the moment. And adding this additional financial requirements going to be really tough on a lot of businesses, even absent a big economic disruption. So don't know how it's all going to shake out, but I expect that is going to be a sticking point.
Yeah.
And it's a fair one.
Maybe it's somewhere where the BC government throws a whole bunch of money at the problem again, at least in the short term. So once we're back to normal days, we can think it through a bit more. But in the short term, people cannot be going to work sick.
Yep, stay home.
Well, now, last Friday, Scott, you had the chance to interview UBC School of Public Health professor Michael Brower on air pollution and COVID-19. Patrons will have had a chance to listen to this episode earlier. So if you want patrons, you can either listen to it again or you could probably hit stop now. If you're not a patron, you can sometimes get early access to stuff at patreon.com/politicoast. But otherwise, let's throw it over to that interview now.
Joining me today is Professor Michael Brower from the UBC School of Public Health. Welcome, Professor Brower.
Thanks for having me.
Oh, you're welcome. So I wanted to bring you on today to discuss air pollution and its public health impacts and what we know about it and how it interacts with the coronavirus. But before we get into that, could you just give our listeners a brief introduction of yourself and the research you do?
Yeah, so my name is Michael Brower. I'm a professor in the School of Population and Public Health at the University of British Columbia. And I studied the links between our environment and pollution in the environment specifically, and how it affects health, especially health of populations. So I'm not really studying what happens to an individual, but how changes in our environment, whether it's more or less polluted, how that affects sort of large populations. And in this case, we're talking today about the health impacts of air pollution. Air pollution is the most important impact or pollutant in the environment in terms of the impacts on human health.
Okay, well, let's jump right in then. So, what are kind of the main impacts of air pollution on human health?
So air pollution affects human health in a number of ways, but really to get down to the ultimate impacts, we know that around the world every year, we estimate that somewhere around 4 million deaths can be attributable to air pollution. So these are deaths from lung disease, chronic lung disease, especially, as well as heart disease. And we're seeing actually even other kinds of diseases that one might not ordinarily think of being affected by something that you breathe, also being impacted by air pollution. Now, we can't ever decide if any particular death is an air pollution death or not an air pollution death. So we look at it as a risk factor that contributes to worsening of diseases. So these numbers are really statistical estimates, but they've been backed by now hundreds of studies done everywhere around the world. So they're sort of our understanding of the impacts of air pollution. And what's happening is that we breathe in this pollution. Obviously, it does affect our lungs, but one of the ways that it affects us is that our body actually tries to fight this as though it were something like a virus or a bacterial infection. And because air pollution isn't something that our body has an immune system that's been designed to fight, our body keeps trying to fight it. And it's actually this response of our body that then sort of starts to affect actually other organ systems. So that's why something like air pollution, we see effects on the heart, we see effects on the kidneys, we see effects, for example, on people with type 2 diabetes. And again, it's just this response that sort of keeps going on because we can't actually fight the air pollution that we continue to breathe.
Right, and I gather there's also been impacts on people's mental faculties. I think there was a study a little while ago about schools that were downwind of major roadways and highways having lower test scores.
Yeah, we're starting to see impacts, even beyond the heart and the lung. So we see things. For example, we've done some recent work looking at dementia, Alzheimer's disease, and we start to see links there. Perhaps also the other kinds of effects on cognitive development in children. There have been some studies suggesting that. Another impact that we have quite a lot of information on is impacts on pregnancies. So we actually see lower birth weight babies in areas of higher air pollution. We see more prematurely born babies in areas of higher air pollution. So it seems as though the more we look at this, there's really not many organ systems, not many parts of the body that can't somehow be affected by air pollution. And then that's sort of consistent with this idea that basically air pollution is producing this chronic response. It's chronic inflammation, which really then affects the whole body. And that's what gives these quite dramatic impacts and some of these very large numbers. Also, just the fact that heart and lung disease are major killers in most parts of the world. So if air pollution has any contribution to those, as we know it does, then we get these quite large numbers.
Right. So my kind of
And I should add just in Canada specifically. So Health Canada estimates every year about 14,000 deaths attributable to air pollution, and that's really quite remarkable given that Canada is a country with some of the cleanest air in the world. So we have levels that are a tenth or lower than levels seen in some of the more highly polluted countries of the world. But again, even in Canada, we see some 14,000 deaths every year. In British Columbia, estimates of around 1,500 deaths every year just in British Columbia.
Right, that sounds quite impactful. There's also going to be, because of the health effects and whatnot, a bunch of economic impacts. Do we have a rough idea what air pollution costs society in general?
Yeah, so we actually did a report with the World Bank several years ago looking at it from a global perspective, and the numbers are absolutely astounding. $5 trillion every year in
Wow.
terms of economic impacts. This is due both to the health impacts, so essentially shortening of lives or lowering of people's ability to have actually economically productive lives, but also in addition the costs due to lost productivity of people who are still alive and working. So we have a number of studies showing that, for example, agricultural workers or manufacturing workers who are exposed to higher levels of air pollution, they're actually less efficient, less productive. So that's $5 trillion globally. And then the estimates in Canada are, again, every year, $114 billion, mostly due to the health impacts, and in BC, somewhere around $11 billion every year are the economic impacts due to air pollution.
Large. I'm actually a little surprised to hear just how big that is. So it sounds like it's a situation where there's really significant impacts, and it makes a lot of sense to try and combat this, just because not only for general health reasons, but as a society, it's costing us a lot. And we'll get into some of the uh, policy recommendations on that towards the end. But is that generally correct?
Yeah, and I guess the other side of this is that if we actually reduce air pollution, unlike many other things that we can change in terms of things that have economic impacts or have health impacts, if we actually reduce air pollution, everybody gets this benefit. So we actually get this benefit sort of across society. We don't have to actually worry about, are we targeting some program, let's say, to some segment of the population. These impacts are felt across the entire society, and so by reducing air pollution by a regulation or by a technology change, we kind of immediately get that benefit. So that's sort of the positive side of air pollution, the fact that that everybody can actually get this benefit. We don't have to worry about actually how to roll out or how to actually target an improvement to the people that need it most.
Right. It really is. Clean air really is a public good here, in more ways than
Absolutely.
one. Well, let's move on to, before we move on to uh, COVID-19 and air pollution, is there any particular source of air pollution that are more harmful than others? What are the ones that are really causing a lot of problems?
So in terms of sources in general, the sources that are produced by combustion, so whenever we're burning something, are more harmful than other sources of pollution. Now that is not going to surprise most people, but it is important to recognize that there are sources such as dust storms, even actually sea spray. So actually just the wave action produces these small particles. We have lightning that actually leads to air pollution. So we do have a number of sort of natural sources, or things like dust storms, which you could consider natural, or also have a human influence on them. Those are harmful. So we know, for example, in the interior of BC, every spring, after the snow is melted, we've laid down, for example, a lot of traction material onto roads. And when the snow melts and things dry up, we get some winds in the springtime. We get these big dust events, and we actually know that is quite harmful. But anytime we're getting pollution from burning, whether that's a fireplace, whether that's burning coal in a power plant, whether that's a wildfire. That seems to be more harmful types of pollution.
A lot of the literature and media coverage of air pollution talks about 2.5
Right, PM 2.5.
PM 2.5. Yeah,
These are these small particles, and they're smaller than 2.5 micrometers in diameter. So just to put that in perspective, a human hair has the diameter of about 100 micrometers in diameter. So these are much smaller than just the diameter of a human hair. We can't see these particles. There are millions of them in the air. Each one of us breathes in and out millions of these particles every day. They can remain suspended in the air for even up to several weeks. So, for example, if we have large wildfires, whether it's in British Columbia or northern Canada, there's evidence that smoke and actually these small particles is what's in that smoke can affect air quality and even affect health in places as far away as the southern U.S. or even the eastern U.S. So those particles are greatest concern from a health perspective, and for a number of reasons. One is, as I just mentioned, that they remain in the air for such a long period of time. They're also very small, meaning that they basically can avoid some of our lungs' defense mechanisms and reach down into the very, very sensitive parts of our airways, and actually cause inflammation in very sensitive parts of our lungs.
well, let's move on to the COVID-19 pandemic and how air pollution interacts with that. The SARS-CoV-2 virus, which is the cause of the COVID-19 disease, is primarily a respiratory virus. It attacks the lungs and the rest of the respiratory system. And acknowledging here that the science is very much rapidly developing, what do we know about how exposure to air pollution can increase risks from COVID-19?
Right. So air pollution and respiratory infections is a link that we've actually known about for quite some time. So respiratory infections like influenza that we see every year, even things like middle ear infections, so earaches that are very common in young children, those actually start out as respiratory infections. And we know that if you have one of these infections, so air pollution is not causing the infection, but if you have one of these infections and then you're also exposed to high levels of air pollution, it makes it more difficult for your body's defense system, your immune system, to actually fight the infection. So that infection becomes more severe. So the ear infection is a really good example. So that starts out as what we call an upper respiratory infection and can progress to affect the ears in a number of ways, but one way is the fact that air pollution retards your body's ability to fight that infection. So now you have this infection that progresses to other parts of your body, and we started to see some evidence of the same kind of interactions with COVID-19. Also from the earlier SARS outbreak, which is quite a similar virus. There was some evidence that on days of higher air pollution, people had double the risk of dying of SARS compared to days of lower air pollution. And there was a recent sort of preliminary results coming out of an analysis for COVID-19 from the U.S. that suggested that the areas of the U.S. that had higher levels of air pollution, people were more likely to die from COVID-19 than in places that had lower levels of air pollution. So all of that's quite consistent now. Again, the science is evolving, and it's very early days to really be conclusive about this, but it is very consistent with what we know about how air pollution interacts with respiratory infections in general. And again, the idea is that it makes those infections more severe. The whole idea behind us staying home, all of the lockdowns, for example, is not that people. So there's two issues here. One is that people are less likely to get infected, but also that the people who get infected, we want to keep those infections so people aren't impacting our healthcare system. And air pollution is something that could take somebody who's already affected and make that infection more severe so that they actually do need to seek medical attention and have that impact on the healthcare system. So that's why it's actually a really important factor here.
Has the desire to keep air pollution down to minimize those impacts being part of the explicit policy making around the lockdown, or is this just kind of a beneficial side effect?
So in locally, it has been, and I think actually in BC, we were sort of one of the first places in the world to actually make this link and actually get it into policy. And this resulted from just what's happening actually at this time of the year. So in many parts of the world, springtime actually is a period of quite good air quality. In BC, we have a number of situations where in some parts of the province, actually, it's a period of rather poor air quality. So quite early on in the pandemic, we were hearing from our air quality agencies, Ministry of Environment, as well as local airshed planning groups that, for example, they were seeing, as is typical this time of year, a lot of slash burning, so burning of agricultural debris or forestry debris. And we're concerned about the impacts, again, because we were in the midst of a pandemic which affects the respiratory system. So quite early on, we actually were able in BC to implement a restrictions on open burning, and I believe now there's now a complete ban on open burning throughout the entire province. And we're also gearing up towards thinking about, we're getting into wildfire season here, and we've already had a few fires in BC, fires also in Alberta, and that's really our most important air quality issue in this part of the country. And so that's a great concern. So there's not a whole lot we can do about controlling wildfires once they exist, but we really want to be extremely vigilant this year about starting fires if they're going to be human caused. So thinking about, for example, continuing bans on campfires or extending those, for example, throughout the whole season is something that has been discussed and I believe is being implemented as well.
Right, and they closed a bunch of provincial parks over the Easter weekend. Is that something that you expect the policymakers will likely continue on through the summer, both to prevent transmission of disease and to minimize any chance the campers started fires?
I think the park closures are more from just the physical distancing as well as sort of impacts on employees and things like that. But we've continued to sort of raise the issue of perhaps this is a summer when we just shouldn't allow, if people are camping and using parks, we just shouldn't allow fires in them, as we always tend to get to a point in the summer when we do ban fires throughout most of the province, and maybe this is the summer when we just do that throughout the entire season, just because of this added risk here.
I've seen some reports that suggest that the lockdown in China is actually going to have a bigger overall impact on health there because of the reduced deaths from air pollution than just stopping the virus would. Based on what we know now, what are going to be the impacts of shutting down so much human activity? And do we have Canada-specific projections on that?
So I'm not aware of any Canada specific projections on that. And as I mentioned earlier, Canada is, in terms of air quality, it is extremely clean. Having said that, we do know that that we still see substantial impacts of air quality, even at the lower levels that we see in Canada on human health. And we of course would never want to trade pandemic deaths for air pollution related deaths. But just given the numbers that we estimate, certainly if we're talking 4 million deaths per year, and we decrease air quality even over 1 to 2 months, 3 months, and in some places this is down by 50%. The numbers will be more than the impacts of the pandemic itself. But I don't really think that's not really the appropriate way to look at this. I think these are both issues, and it is a reminder that even while we're in the midst of a pandemic, which is horrible and tragic, we do have these sort of ongoing issues, which we may get slight reprieves from them, but they've been going on for years and will continue to go on for years, and do have really huge impacts on the health of populations, both in Canada, but also elsewhere around the world. Probably the more important question is what happens when we start to emerge from the current situation where we've really got shutdowns of major sectors of the economy. Do we go right back to the way it was before? And there's some evidence that even though China saw these improvements of air quality as they started to ramp up their economy, things are going back to similar to how they were before. Or do we actually take this as an opportunity to, the United Nations has been using the phrase build back better. Do we actually use this as an opportunity to take action on some of these longer standing issues? If we're going to be thinking about having to restructure our economy just because of the economic impacts, but also considering, for example, virus transmission, can we do this in a way that where we also lessen the impacts on the environment? And another aspect of that is it's been quite interesting that in many parts of the world, people have now visually seen what clean air looks like. It's very easy to get used to sort of subpar air quality. You may not really notice it if that's the way it's been your whole life. But now all of a sudden you see these amazing blue skies that many parts of the world and even parts of Canada may not be used to seeing. And we've seen some evidence from both anecdotally, but also from some small surveys that people really like this. And they really appreciate it. And so there's an opportunity here to capitalize on this experience and try and actually deal with what has been a long-standing issue.
Well, let's dig into that a bit. After the pandemic draws to a close and the social distancing and physical distancing gets eased off, there's also going to be a lot of economic and societal recovery that's going to need to happen, and we're likely to see a fairly large package from multiple levels of government be put out there to try and get society and the economy restarted. How would you recommend we use that to minimize air pollution going forward?
So, yeah, in terms of air pollution, and I think we also need to think about the transition that we need to make to net zero carbon economy as well. We should be asking those questions about every dollar that we're spending. Is it going to, can we spend that dollar in a way and making sure that this isn't going to lead to air pollution? This isn't going to lead to an increase in emissions related to climate change. And we certainly have the technologies, we have the solutions to actually let society function and let our economies function in a way that is much less damaging to the environment. And so I think it's really asking those questions, not just saying, here's the money, spend it however you want, get back to normal. So what might that mean? That would mean prioritizing clean energy. That would mean prioritizing, and it's very complicated to think about how we're going to do this in a safe way. But let's say prioritizing public transit as opposed to private vehicles, prioritizing efficiencies in industrial processes that reduce their energy needs or allow them to use alternative energy sources. Lots of things like that are, it's going to be the devil in the details, but I think it's really just actually having this sort of checklist and saying, any dollar we spend, it should not be having negative impacts on the environment. And then there's also other things that have for a long time been sort of low hanging fruit. One of the interesting things that I noticed in the first days of the sort of lockdown periods was that many people were staying home and they would light up a fireplace because, well, that's what you do when you're stuck at home. And that's really just for sort of ambiance. Most people, especially in our metropolitan areas, in our cities in Canada, that's not a primary heating source. And that's actually a huge source of air pollution in our cities. So, for example, in Metro Vancouver, that's probably the leading source of these very, very small particles.
Really,
So we're actually
more than cars.
more than cars, and that's because our cars today are so much cleaner than they were, even 10 years ago, let alone 30 years ago. We've had huge improvements in the technology from our motor vehicles. So while they still are a source of air pollution, and they're certainly a very important source for emissions related to climate change, in contrast to something like a fireplace today is really no different than a fireplace was 500 years ago. So we really haven't done much to improve that technology. And it's also something that, while it's nice, we don't really need it. So the idea that we're sort of burning wood, creating this pollution in our major cities, I think it's time to really think about, should that be allowed at all? Obviously, in a remote area, in a cabin where you're not in a densely populated area, that's an individual choice to make. But in a city where one fireplace can affect hundreds of people in the vicinity, perhaps now's the time to think about those kinds of sources, which really there's no cost to basically not allowing that kind of pollution.
Right.
And again, maybe taking this experience that where we just have this idea of how good air quality can be when we sort of change our way of life, as an example.
So I believe new buildings can't have fireplaces, but this would more be a policy of prohibiting their use in existing older buildings, correct?
Yeah, that's correct, and for a number of reasons, sort of newer buildings, sort of wood burning fireplaces, just from the fire hazard, and actually insurers often won't actually insure a building with a wood burning fireplace now right, this would be the tens of thousands of older homes and buildings that have wood burning fireplaces and are used, and then also, again, things like I mentioned earlier, like open burning. We have regulations about that, but perhaps they need. So this is open burning of agricultural waste or forestry debris. We do have regulations, but perhaps they're going to, they could be tightened as well. Again, just thinking about the contribution that they make to poor air quality.
So, what role do the different levels of government have with respect to improving air quality? We've already talked a bit about prohibiting burning within cities, but there's also issues around where housing gets located near major roadways. But also, there's provincial and federal roles. Do you kind of go into what the different levels of government have with respect to? Could you go into the different responsibilities the different levels of government have with respect to air pollution problems?
Sure. In terms of responsibility, most of the responsibility is at the provincial level. In some cases, the province will delegate that to other agencies. So, for example, in Metro Vancouver, the province has delegated air quality to Metro Vancouver, or what used to be called the Greater Vancouver Regional District. And that's sort of typical across most of the country that things are done at the provincial level. In BC, what tends to happen is the province will tend to set up sort of airshed management groups, which are a combination of basically provincial oversight, but working together with local stakeholders. So that would mean both local government, but also citizen groups, and, for example, the economic sectors that are important in a particular region. Federal jurisdiction focuses on things like requirements for motor vehicles, so that we have a uniform standard across the country. We also do have federal air quality guidelines, but often the provinces will actually exceed those air quality standards. But then you also get into sort of interesting issues like federal lands that are located in areas. So, for example, the port and port authorities that's federal land, and those actually tend to have sources of air pollution. So those you have to work together with the local authorities, even though they're sort of under federal regulation. So it can become quite complex, but in general, most of the action is undertaken at the provincial level.
Right, and with respect to the port, a lot of the ships burn bunker fuel, which is basically the lowest rate of fuel possible. So they have a particularly outsized role in air pollution, correct?
In North America, actually, for several years now, we've had fuel quality restrictions as in port and actually close to the coasts. Certainly, in the open seas, it's absolutely correct that you can still burn much lower quality fuel, but that has been a federal action, and so actually there's been quite a bit of improvement in the impact of that marine sector close to populated areas, so in port as well as when they're close to coastline. So that's been actually a source of progress in the last few years. But ports are also a major destination, for example, for truck traffic. It's not just the marine vessels themselves, but also all that activity that goes on at port land. Lots of, again, trucks moving containers, for example, or other equipment that's moving containers, that kind of thing as well. So it does tend to be an important source in cities that have ports.
Near the start of this, you just mentioned how large the overall costs are to the society and the economy in general. Do you have a rough estimate of what the cost benefit is going to be? And I know it's going to depend a bit on each intervention of tackling air pollution.
Yeah, it does depend, but the sort of best examples that we have been, up until recently in the U.S., they're actually required for every federal regulation to do a cost-benefit assessment. And every year that they did this, air quality regulations were the most costly of all federal regulations. but also were the ones with the greatest benefit to cost ratio. And that ratio, depending on the regulation, was anywhere from sort of a 4-to-1 ratio to a 30-to-1 ratio. So every dollar you spend, you get $30 back in benefits. Again, because of these large impacts on health. For the most part, every air quality regulation that is contemplated is beneficial, and it's highly beneficial from a benefit cost assessment. And it's a little bit more complicated in places like BC because our air quality is quite good. So we've already, for the most part, dealt with sort of the low-hanging fruit. The things that are easiest and least expensive to deal with. So we are getting into places where we're more at that 3-to-1, 4-to-1 ratio, but we're still quite positive from a benefit to cost perspective.
Right. So we should still be trying to put quite a bit of resources into this during the kind of recovery and rebuilding effort, just because the impacts are so large.
Yeah, absolutely. And again, as I stated earlier, that's sort of one of the beautiful things about improving air quality is sort of if you do it, you get this benefit kind of across the board, across the society, which is quite different than saying something like even something like smoking, tobacco smoking, for example. We know that's also quite harmful and quite costly from a health perspective. But how are we actually going to implement that? We have to really target things to specific individuals, specific groups. We sort of have to say, all right, who are we going to identify who's smoking, who's at risk from smoking? What programs are we going to implement to make to help people stop smoking? All of that kind of thing. Whereas air pollution, you just clean the air, everybody's breathing. You sort of get that benefit right away, and again, very equitably as well.
Right. So I've sometimes seen EV rebates being criticized as kind of giveaways to wealthier people who are generally the people who can afford, Teslas and other more expensive electric vehicles. But because of this and how widespread the impacts are going to be, it actually is more equitable than it seems on just the initial face of it.
Yeah, I mean, there still are issues with, could the people who are buying Teslas just buy them, or would they buy them anyways? And should they buy? They should be buying them anyways if they can afford them, making that choice. So, I think there sort of are issues, but the fact is that if they're driving that vehicle compared to a vehicle that's creating more pollution or creating more emissions related to climate change, there will be a larger societal benefit from that. So I guess two sides to that coin still.
Right. There's definitely some tweaks that could probably still be made, but it's not necessarily as inequitable as it seems on its face. It's probably where it comes out to. Just one final question before I let you go. This is kind of circling back a little bit to the general population level stuff, but do we have an idea of what the sociological impacts of air pollution are, and which groups bear the largest impact in general, and as well as the interaction of the virus and air pollution?
So in general, we certainly know that the people in terms of health impacts are people with pre-existing diseases. So even though air pollution causes some of the diseases, there are also many other causes. So this tends to be, the older segments of the population, as well as the very young. So we're especially concerned with pregnant women and young infants. Now that's sort of very general from an age perspective, thinking about it from where people live. And we know in Canada, but also elsewhere around the world, that people of lower socioeconomic levels, so people generally with lower incomes, lower levels of education, tend to bear more of the brunt of air pollution. due to a number of factors, where they can afford to live. So, for example, we've done lots of work locally on sort of transportation related air pollution, and we know that people who live close to major roads and in areas that are more densely trafficked, they have a much higher impact of air pollution than people who live farther away from those roads. We know that people who tend to live in sort of lower lying areas compared to sort of up slope tend to get higher levels of air pollution and are more affected. And all those sort of have economic links. So who are those people? It tends to be people who have lower incomes. And this is even more extreme. If you go to the U.S., it's not just an economic issue; it's actually a racial issue. So there's longstanding sort of segregation of cities in the U.S. Based on race. So even if you account for incomes in the U.S., ethnic minorities, so African Americans and Hispanics, tend to actually live in areas with higher levels of air pollution and bear the brunt of that. And in Canada, we see some of that in some of our First Nations communities as well. So they're, for example, still using diesel generators to provide power. Because they've never been connected to the power grid and actually don't have access to some of our cleaner sources of power. And to some extent, the same thing happens in our metropolitan areas that are both some recent immigrant groups and First Nations tend to live in areas with higher levels of air pollution.
Before I let you go, is there anything else you feel we've missed or should discuss?
No, I think just to add sort of locally, I mentioned this earlier, but our major concern from an air quality perspective, especially this time of year, are wildfires. And so it's just important from a planning perspective to think about quite likely that this pandemic is going to be continuing as we move into wildfire season. This interaction between air pollution and COVID-19, this could rear its ugly head if we get a wildfire smoke event that starts to affect large populated areas, such as the Lower Mainland, as we've had in some previous summers. So now is really the time to prepare and plan for that, and a whole host of things, which understandably are going to be difficult to do in the middle of a pandemic, but a whole host of things that we and people individually should be thinking about. And that means for people who have pre-existing heart and lung disease, really making sure that their disease is as well managed as it can be, so that they have enough medication. We've had some discussions about long-term care facilities, which we know have been sort of the heart of the COVID-19 situation in Canada in general. Do they have, for example, high enough air filtration so that if there is a smoke event, they can filter the air? So again, now's the time to be thinking about looking at their ventilation systems and making sure they're working as well as they can and they have appropriate filtration. Individuals who know they're sensitive to air pollution and may also be among those groups that are perhaps at greatest risk from COVID-19, thinking about purchasing home air cleaners, stores making sure they have enough supply of air cleaners, all of these kinds of things. We should be thinking about those things now before we have an event upon us.
Okay. Well, if our listeners are interested in finding out more, do you have any recommendations where they can look, or as well as where they can find your work?
Yeah, a few good places to look are, so the BC CDC, the British Columbia Centre for Disease Control, has a number of fact sheets on air pollution, wildfires and air pollution, and a number of the issues that we've discussed. Also, the British Columbia Lung Association has a wealth of resources, including we have lots of short videos that have been prepared over a number of years on all kinds of aspects of air pollution. And then for air quality levels, Metro Vancouver, the measurements of air quality that are done 24/7, that's all available easily online through Metro Vancouver or through the province. Just look for Air Quality BC.
Dr. Brower, thank you for joining me today.
My pleasure.
And that has been Playtoast. Find links to everything we talked about at playtoast.ca. Support the show and get access to our Slack channel at patreon.com/playtoast. Our intro music credit is Beautiful British Columbia by Serge Plotnikoff. Playtoast is a production of Legend Boot Media, and editing services are provided by CHLY 101.7 FM in Nanaimo. Wash your hands and stay home. Thanks for listening.